All right. Well, good afternoon, everyone. Hope you're enjoying your Friday. Happy December. Welcome, December. Welcome to the last month of 2020. We've made it. We're going to keep doing what we do and helping educate folks. And with that, I'm going to turn it all over to Dr. Laura Lee Hall, who's our expert in flu vaccinations and all things. So, Dr. Hall.
Thank you so much, Brandon. Does everyone hear me? Just a nod of the head. I see our participant list is continuing to grow and we have over 59 now. I'm going to share my screen to do some introductions. So let me work on that. We're up to 61. So what a committed group of people. And I thank everyone for taking time today to continue working on this important topic. You see the title, Making an Effective Flu Vaccine Recommendation, What Research and Experience Has Taught Us About Patients of Color. I really want to do a shout out to Keiko Purnell, who has been running the Friday webinars for NMQF this year and has been masterful. She makes it so easy and does it with such grace. So a shout out to Keiko. Our main speaker today is Dr. Sandra Quinn. Now, I am really fortunate to have been able to get to know Dr. Quinn and work with her over the last several years. You see here on the slide that she is professor and chair of the Department of Family Science, as well as senior associate director of the Maryland Center for Health Equity at the University of Maryland School of Public Health. The title of her presentation, which she will jump into as soon as I'm finished with a few comments, is Increasing Influenza Immunization for African Americans, the Urgency of Now. And I would just note, rather than read her extensive CV, that she really is a foremost expert on factors influencing vaccination in African American adults. And she's always having an eye towards what it means for making things better in the real world. So we're delighted to have her. I believe that Dr. Kusher, Matthew Kusher, is a Maryland graduate as well. He's the clinical director at Plaza del Sol Family Health Center in the Urban Health Plan. I've had the pleasure of working with him and his team for a few years now as well, deeply committed to their diverse community of patients at this FQHC. And I've just put a little link down here or a picture. Yesterday in the New York Times, there was an extensive article about COVID-19 and how it hit Queens, including in Corona, where Plaza del Sol is. And so they were at the epicenter from the very beginning and yet remain committed to flu vaccination as appropriate. So along with Dr. Kusher, we're very fortunate to have Dr. Jaqui Jones, another family medicine physician who is practicing in Columbia, South Carolina. And you see here, I have a little excerpt of a podcast that she recently gave. I understand that Dr. Jones is an amazing presenter, and we are very fortunate to hear from her as well. I'm sorry, so who's ever not on mute, please mute yourself. So Dr. Jones and Dr. Kusher are going to keep Dr. Quinn honest because they're going to provide a little bit of comments in terms of putting this into practice in the practice setting. I just have a couple of slides to set up the conversation. And this slide really could just be a sentence that we actually know how to increase flu vaccination rates, including in diverse and underserved populations, by teaching the team to make a really strong recommendation. We have worked with the practices represented on this call and many others to realize significant increase in flu vaccination rates. It's really the MAs, the nurses, the physicians, other parts of the practice staff can make a huge difference. We've tried to distill all of the positive experiences and resources that our practices have been implementing to increase flu vaccination, and they're located at this place. Oops, sorry, shcdrive.org. It's a toolkit that really will help you do what the best have been able to prove over the last few years. One of those tools is the immunity learning site. And you see the URL right here. It is really a curriculum. That sounds like a scary word, because the modules are quite short, 10, 15 minutes at most, and they're very practical, like examples of conversations and the value that you bring as a provider, clinician, practice staff person in terms of making vaccines happen. And it's the online tool actually is geared towards whatever your professional role might be. So I would urge you to share this with your staff. It's something that can be fun to implement. It's interactive, it's got videos, and it's very practical. We, of course, have a ton of resources that you can use for communications purposes. And most recently, you will be able to find on Monday our infographic for patients promoting flu vaccination and helping them understand prevention of flu, treatment of flu, and flu vis-a-vis COVID in Spanish. So look on Monday to find them. And here's let me go back. Here's the location. Next week is National Influenza Vaccination Week. And the message is there's still time to get your flu shot. We're only about halfway through our flu vaccine our flu season. So we are inviting everyone, and I invite everyone on this call to go to our resource page, which is the URL I had on the previous slide. It's hidden below what you are sharing screen information. We have sample letters to the editor in both English and Spanish promoting flu vaccination. We urge everyone to go download it, make it your own, and submit it in your community next week to continue getting the word out during National Influenza Vaccination Week. I think these are the right notes, and Keiko will add a note in the chat box if I'm wrong, but you can enter questions into the Q&A box and we'll try to answer your questions, and a recording of this webinar will be available next week. So that's all I have. I'm gonna stop sharing and turn it over to Dr. Quinn.
Thank you, Dr. Hall. And one of the reasons I always like working with you is that it really is about how do we take, anything that our team may learn from research and turn it into tools that Dr. Kusher and Dr. Jones can be using out in the field. And you're right, keep me honest, so Keiko, you're gonna pull up the slides, I believe. So what I'm going to do is share with you some research that has been mixed methods research funded by the National Institutes of Health, and looking at what are the persistent disparities between racial and ethnic groups. Within my long-time focus has been particularly on African Americans, and how do we overcome myths, misinformation, and a whole history of things that make it difficult to have to get the kinds of vaccination rates we need to protect people, particularly when we know there's a burden of chronic diseases that put people at a higher risk if they become infected with the flu. So there we go. Thank you, Keiko. So next slide. So what I'm going to do is sort of do a summary of some of the quantitative and qualitative results. There's a lot more, but summarize some of the key things. And I'm building this on a couple of, the data I'm building this on includes 9 focus groups with whites and African Americans, separate groups, extensive individual interviews, and a national survey with over 800 white and over 800 African Americans, and it was representative of those 2 groups in the population. Next slide. So, you know, I'm sure my clinical colleagues here would agree that certainly the perceived risk one has with regard to flu is a predictor of uptake. But what we heard a lot was, number one, the myths. Well, flu's just like a bad cold. Always said by somebody who hasn't had the flu. But the other thing that we heard qualitatively and we found quantitatively in our survey is that African Americans had a higher perceived risk of vaccine side effects. But more than that, is they also saw them as serious. You know, people would die. People would have serious long-term repercussions. And that, you know, we know that if people see the disease risk is high, they're more likely to take the vaccine. But when, for African Americans, that perceived risk of vaccine side effects goes up, then suddenly, even with perceived disease risk, then uptake begins to go down. Next slide. The other thing that we heard in our qualitative research was really sort of a different approach to how they thought about vaccines between many of the whites and African Americans. And we began to think about this as perhaps, you know, that we really needed to also explore people's lived experience from their perspective of their racial group. So we created a number of scales. We tested them before we did our survey. And one was about perceived fairness. How fairly do you believe you and people of your race are treated in the healthcare setting? We ask another set of questions about, you know, how conscious are you of your race in a healthcare setting? So if you are African American and you're in a setting where most of your providers may be white, or patients and providers, how conscious are you of your race in the setting? And finally, to what extent had they experienced discrimination in the healthcare setting? And so what we found was when people believed that they were treated fairly, that not surprising, they had more trust in the vaccine and they had higher vaccine uptake. But when people had a higher consciousness of their race in a healthcare setting, that actually was associated with lower trust in the vaccine and the vaccine process, and I'll talk about that in a minute. Higher perceived risk of side effects, less knowledge of flu in the vaccine, and greater hesitancy. The other thing we found was if there was a higher perception of discrimination, not surprisingly, that was associated with higher perceived side effect risks and lower uptake. Now, my colleagues who are going to be speaking now are people that work with African Americans and Latinos all the time. But for those providers that don't, we know we still have a history of racial bias and often differential care, even when there's income and access to insurance. So racial factors are important here. Next slide. We also found that people really didn't understand the vaccine process. So how does this happen every year? And why does it happen every year? And so we created an infographic. And again, we tested it before we used it in our survey with people that we were trying to reach. And really looking at sort of how do we decide, you know, new strains every year, the production process, the approval process, the recommendations down to, you know, the person that puts it into your arm. And what we found was that African Americans had a lower trust in sort of all of these sort of players in the process. Doctors, and this is something, of course, we heard consistently, is that their own provider, they had the highest trust in. and CDC, FDA, and drug companies last. So the rank order was the same for whites, but just lower trust. But that trust in the vaccine in this process were really essential for uptake. Next slide. There are a couple of other things that predicted trust, though. And so, some of this is kind of, I don't want to say what comes first, the chicken or the egg, but quantitatively speaking, in terms of survey results, when we ask what predicted trust in the vaccine, certainly perceived risk of both the vaccine and the disease, perceived effectiveness, which is something we often hear, how important people thought the vaccine was, and subjective norms. And by that, we mean we asked some questions about, how many of the people that your family, your friends, want you to get the flu vaccine. We also ask about how many got the flu vaccine themselves. And so those were predictors of trust in the vaccine and the process. But what we heard qualitatively was that while whites were, if whites indicated distrust, they talked about competence of government. But when African Americans talked about distrust, they talked about the motives. Is government action in our best interest as a community? But the other thing we heard was, even though we heard people who raised Tuskegee, as, their reason for why they don't get a flu vaccine. And what we also heard was, what we came to recognize was that for African Americans, this is not a passive decision, and that it was much more of an active decision, often saying, I'm willing to set aside, Tuskegee and past incidents and step out on faith and get the vaccine. Next slide. And trust in the vaccine was positively associated with confidence in the vaccine and the perceived convenience of being able to get it, and negatively associated with complacency. So people who said, oh, it's really not important for me to get it, and with hesitancy. We also always ask, did you get the flu vaccine this season? We put dates around it. How frequently have you gotten a flu vaccine in the past 5 years? Never, once or twice, most years, but not always, in every year. And certainly, not surprisingly, adults with higher confidence in the vaccine were more likely to get it. Part of why this is also, I think, important in the COVID period is that we knew in H1N1, our results, as well as others, indicate that past flu vaccine uptake was a predictor of getting the H1N1 flu vaccine when it came out. Because as you recall, there were two, the seasonal and the H1N1 in 2009 and 2010. So this is, I think these have meaning for us today beyond the flu vaccine as well. Next slide. We talked about social norms a moment ago, but I want to hit this last point that I didn't mention earlier. And so in the quantitative work, what we found was for that those that got vaccinated every year or most years, that they were more likely to believe it's my moral obligation to other people to get a flu vaccine. And again, I think this is not only important with regard to flu vaccine, but I think this may be very important with regard to COVID vaccine uptake. Next slide. So what do we do? And I'm eager to hear from my colleagues shortly. Next slide. Some of you may be in public health agencies, and I didn't share all our results, but certainly one of the things that we found was while knowledge is not sufficient, it is important. And when we saw higher levels of knowledge about the flu, about the vaccine, about the process, about recommendations for who gets it, and that was associated with higher uptake. We often talk, most frequently, I would say, especially when we're doing communication messages and all, we talk about perceived disease risk, we don't as often talk about perceived risk of side effects of the vaccine. And I think we have to do a much better job in some of our health communication efforts. And I suspect that my colleagues are going to be ones that address this when it comes up. You know, I think the other thing that we hear, going back to that moral norm, the social norms, is that this season, maybe more than ever, to really talk about the individual and collective benefits of the vaccine. And, you know, more and more when I'm talking with community members, it's about yes, how you protect yourself and your loved ones, but how do you protect the healthcare workers who are out there doing their jobs every day? How do we minimize the impact on hospitals, you know, that are already grappling with COVID? So I think this is something that I think is important and harkens back to some of those social norms. And finally, minimizing barriers like cost, convenience, and safety right now. I went to my primary care physician. I call from the parking lot. They come out. I stick my arm out the window. I've got my mask. She's got her mask. I get my vaccine and I'm done. She's safe. I'm safe. And I've been vaccinated. Next slide. But healthcare providers, I cannot say enough about the importance of providers, because the bottom line is, you know, what we saw in our data was people said that the provider's recommendation was important, and it was very important to them. And so I think more than ever, there will need to be really sort of working between, you know, hospital systems, pharmacies, and other groups. And Laura Lee is good at leading some of these, or stimulating many of these efforts to get clinics out into communities. She and I are involved in with a number of others who are leading the effort to get the health department clinics out into churches, in Black churches in Baltimore. The other thing we know from the literature is that even when African Americans are more likely to have a visit during the season, they are less likely to get a recommendation and offer. So there's a disconnect. They're literally in the office, but they're not getting it. And yet we know that when it is, as Laura Lee had referred, you know, when it is a presumptive recommendation, as opposed to, would you like a flu shot today? Which is what I've heard many times. Then when it's a recommendation and the offer at the same time, that's vital. I always do little interviews when I go to the providers. I live in Prince George's County, Maryland. My provider offices are the staff is very diverse. And I always do little interviews, right? So to the nursing assistant, do you take the flu vaccine? No, I've never had the flu. Do your patients take the flu vaccine? Well, some do, but many don't. So that point of being a role model and taking the vaccine, you have enormous influence, and let's, you know, see it used more often to help. So next slide. One of the things in some of our work with my colleague, Dr. Broniatowski, is to look at how do you get to the gist, you know? And so what we have proposed is thinking about, you know, how do you establish credibility? How do you address some of the issues that need to be addressed? And so starting with an evidence-based fact or statistics, but then how do you get it to the point where it has meaning for your patient? And that is, you know, what this means to you, or the bottom line for you is some message that says, okay, what I've just told you about the statistics is important to you. And then the gist, what is it you want them to walk away with? Next slide. And so this is just an example. We know the flu vaccine is approved annually and safe with only minor side effects. So that's addressing that issue. That's data. We know that, and it addresses one of the concerns we know that's important. The reason that is important is that with your type 2 diabetes, you're more likely to have serious complications if you get the flu. I strongly recommend you take it, and I can give it to you now. That's a lot harder to turn away from. And it builds on your credibility and your trust as a provider. It opens, hopefully then, a dialogue about what are their concerns. But it's far more likely to result, at least I believe, now we're going to hear the real deal, in somebody saying, I'm going to do this. Next slide. So, we're pivoting now to this, COVID vaccines. FDA, go back one. FDA is going to review the Pfizer vaccine for emergency use authorization next week, the Moderna vaccine the following week. So I, with a number of colleagues, are going to start a series of webinars, and I talked to Dr. Hall about sharing some of this. This is where we are right now. Some of these titles might be a little bit of a work in progress as we go forward. They are open to everyone. And, no matter where you are in the US, and the whole goal really is to help public health professionals, healthcare providers, community health workers, be able to talk about things like, what is an emergency use authorization? And what does that mean? And how's that different? And when somebody says, well, we're Black people in those trials, we're Latino people in those trials, you will have some tools to work with. So next slide. So first, I have to thank you. I mean, at this point in time, what you do to protect the health of your communities and your patients is awesome. And I have to thank you, and I look forward to hearing comments from my colleagues here.
Thank you so much, Dr. Quinn. I wonder if Dr. Kusher, if you would like to provide a few minutes of feedback about what it looks like from where you sit in your clinic and how you're successful in promoting flu vaccination, and maybe even thoughts about COVID.
Good morning.
There you are.
Okay. So as Laura Lee discussed, I work at Urban Health Plan Plaza del Sol in Corona, Queens. Where is Corona, Queens? Corona, Queens is right next to Elmhurst Hospital, which the New York Times had a blockbuster reporting about in March, right at the what was happening here in New York in terms of coronavirus testing and coronavirus infection. But I'll get back to coronavirus. So let's start with the flu. So we are at a Latino health center, and the Latino community views the flu a little bit differently and sees things differently than the African American community. They don't have the same perceptions in terms of Tuskegee and the worry about being guinea pigs like the African American community really does, because of the history of discrimination within the United States in terms of medical care in the African American community. The issue with the flu vaccine more has to do with a way of actually discussing the flu vaccine. Why do I say that? So influenza, the word influenza in Spanish is la gripe. The thing is, everyone uses la gripe not just for flu. They use it in layman's terms for cold. Oh, yo tengo gripe en mi ojo. I have cold in my eye. If they have congestion in their eye, they say they have gripe in their eye. If they have any sort of congestion in their nose, oh, yo tengo gripe. So when the health department talks about, when other providers talk about, oh, la vacuna contra gripe, the flu against the flu, which is the correct medical term, patients say to us, well, I don't want that because I got the vaccine and I still had 4 or 5 gripes in the year. They still had 4 or 5 colds during the season. So they think, well, why should I get a vaccine? Why should I stick something in myself when really it doesn't help me at all? That word choice does make a tremendous difference because it's the perception of the patient as to whether or not it's going to be effective just based on that word choice. So what we do here is we talk about el flu, la influenza. And we emphasize the fact that it's against influenza, as opposed to using the layman term of gripe, or the way that the layman perceive gripe, right? The actual word for cold in Spanish is resfriado. Resfriado is cold. It's common cold. But nobody uses that. Very few and far between patients actually use the word resfriado. They all use gripe. And so then when I see on the subway that DOH has posters saying, oh, la vacuna contra la gripe, it just furthers the narrative that this vaccine against influenza is against common colds, which of course it's not. So therein lies our biggest challenge. How do we tell people that this is against influenza? It is not against the common cold. Because if we're able to overcome that, when we are able to overcome that, that is when people are willing to accept the vaccination. Because even in our very bad flu season a couple of years ago, patients were unwilling to accept the flu vaccine because they thought that the flu vaccine was going to make them have more colds in the year, when of course that has nothing to do with the flu vaccination. So that is where our starting point is. Now, what else have we been trying to do besides just doing the offer and doing the recommendation at the same time as Dr. Crouse was talking about? We have been having elected officials coming into our health center and getting the flu vaccine in our health center, and then sharing on social media about the fact that they have been getting their flu vaccine. We had the state senator from our district. We had the assembly, we had the city councilman from our district. We had the congresswoman from our district come in, who posted on Instagram or one of those social media platforms. She got 1 million views of her receiving her flu vaccine. Because as Dr. Crouse was talking about, and as we have seen in reality, people look towards their role models as to what they do. Now, I truly did not believe that in terms of medical care, people would do that. But that changed. That changed for me with the way that we have seen role modeling with masks when it comes to COVID. We know that there are particular people who wear masks and people follow that, or they don't wear masks and people respond to that as well. People really do respond to that role modeling much more than I would have thought. So it has encouraged us to try to push to get our representatives to come and get their flu vaccine. Our main so that is what we try really to do, but it's mostly about how do we connect the fact that flu vaccine is to flu and not to cold. If we can make that work, then we can make it happen. It's not about price, even though a lot of our patients are uninsured, because people are willing to pay for the Tdap vaccine, which is every 10 years, even though the flu vaccine is cheaper. Not because it's every 10 years, but because, that they recognize is important. But the flu vaccine, that they somehow equate that with the common cold, they can't make it happen for themselves. Now I'll just talk briefly about COVID. So in our community, we have 50% positivity for antibodies in our community for COVID. We are the highest in New York City, a city that was struck very hard by COVID. Why were we hit hard by COVID? Because we didn't know it was here. I can tell you that I personally saw patients at the end of January and February with COVID, and we didn't know it at the time. And so it was growing and growing, and it exploded. So it was here well before, when California was talking in January, the first cases of community transmission. Just there, it's only there. It was already here. It was already in New York. It was already having community transmission here. And so we had the explosion here, not because we went from 0 to 2,000 hospitalizations in a week because all of a sudden people started getting sick from one case in Westchester. The cases were brewing without testing. Our community was going to accept the COVID vaccination because they realize how deadly it has been, how many of our community members are gone, how many deaths we are still finding out about. I'm still calling patients and finding out that they have passed away. Our community is going to accept the vaccine because we know the deadly consequences of what has happened. And now I throw it back to you, Dr. Laura Lee.
Thank you so much, Dr. Kusher. I think we have Dr. Jones back now. And would love to hear your perspective from Columbia, South Carolina. Dr. Jones, can you hear me? You're on mute, Dr. Jones. There you are. Here you come. Keiko, can you give Dr. Jones permission to unmute? Thank you, everyone, for your patience. Dr. Jones, can you try to unmute on your computer? There you are. I can hear you. Can you share your screen? I know you have a few slides. We can hear you, Dr. Jones. All right, so you're having trouble sharing your slides. Maybe as you work with Keiko to share.
All right, I'm promoted. I'm back in business.
Sorry for the technical challenge, Dr.
That's okay. Jones. That's okay. Welcome to family medicine, right? I tell people all the time, to be a family medicine physician is to learn how to succeed in chaos at times. So this is okay. I'm going to share my screen here. And can you see me now?
Yes, we can see it.
All right. So my name is Jaqui Jones. I'm a family medicine physician here at Prisma Health in Columbia, South Carolina. And I want to talk about taking the shot, the flu shot, that is a quick roadmap. What we cover here in my clinic, why is it important, a few CDC minority stats, who needs it most in the people that I see, and how I get it done. In my clinic, I do quadrivalent flu shots primarily, and it's really three major groups. My 65 years and older group, because they get a high dose vaccine, and then everybody else in between, right, from 6 months to 64 years of age gets a standard dose. There is a special category that I see, and I make sure to educate moms about this. So all of my patients somewhere between 6 months of age and 8 years of age, if they have not had 2 doses of the flu before July 1 of 2019, then they have to get a 2-dose series. I make sure to educate my moms on that because it looks very different than what we all know about the flu shot. You come in, you get one, and you're done. And so moms want to know, why are you sticking my children twice? And it is because they're brand new, and so they get the one-time 2-dose series 4 weeks apart. And so we make sure to educate them on that. Why it's important is because we know, and these are some numbers from the CDC, that minority populations, people with low socioeconomic backgrounds have high incidence of hospitalization and influenza-related injury. And in this COVID pandemic, the one thing that has become very clear to me that I'm hearing from my patients is I will do whatever it takes to not have to go to the emergency room, and I do not want to be admitted to the hospital. So I am seeing sometimes higher acuity care in the clinic because patients are very motivated to not be admitted for anything. And it has become both a concern that I address and a marketing tool to make sure that if that is our goal, then the flu shot becomes a part of those tools of care to make sure that we keep both you and I out of the hospital. So it's a very important point that we stress in my clinic. Who really needs it? Everyone, of course. But I want to make mention that over the years, with the exception of the dip in 2017, 2018, our compliance for flu vaccinations has actually been improving. Now, overall, I think nationwide, we're still only at about 48%. And if anybody out there is a clinician that works in a clinic, you know that's in stark contrast to all the enterprise goals that say we're supposed to be vaccinated at 85 to 90%. So some of us look at the CDC numbers and go, well, how on earth am I going to get this done at 90% when as a nation, we're still hanging out at 48%. And so I think it boils down to knowing your patient population and who really needs it. So my high risk group, 65 years and up, my very young, and then all of my chronic disease patients. I carry a lot of, I do a lot of chronic disease management. I have really elevated BMIs in my clinic, anywhere from the 40s. I think I have them up as high as 75 for BMI. So that makes them at significant risk due to morbid obesity. My COPD, my diabetes patients, my patients with high cholesterol, hypertension, coronary artery disease, HIV, they all come in and they see me. And so one of the things that we really let them know is when they were asking who really needs it, we were talking about you. So educating them on who they are and where they fall in the categories has been a really big push so that they understand why we're even having this conversation. The CDC and the AMA have been doing campaigns. They do them every year that kind of help us structure our approach in clinic on how we want to do it. Now, I think for most of us, this is an unconscious thing that we do, but the share model happens every day in my clinic. Now, I am currently practicing in Columbia, South Carolina, but I'm from Chicago, Illinois, and I trained on the south side of Chicago in Inglewood, also born and raised on the south side of Chicago. So a mentor of mine once told me that your patients find you where you are. So if I had thought that I would move all the way to South Carolina and not see people that I grew up and knew in Chicago, I was wrong, and she was very right. So I feel right at home because you kind of see the same people because they tend to gravitate to folks that they think understand them, speak their language, communicate with them in ways that is going to make sense. So one of the first things we do, a part of the share, is tell them why influenza vaccine is right for them, right? Why should I get the flu shot? So I'm also a student athlete. I played basketball at the University of Alabama. So flu season sometimes feels like the Sweet 16, right? You train all year for this. So I am trying to see, trying to know who they are, right? So I will check, do you always come to my clinic every December for upper respiratory infections? Like, are you always sick this time of the year? Do you have some random albuterol prescription that's on your list that you never use until this one time that you're sick? Trying to figure out who are you, what's your age, what's your status, what's your lifestyle, where do you work? We use all of that to give them reasons. I have lots of factory workers. I want them to know, you're in a factory with a lot of people, and you were complaining last visit that Mr. T keeps coughing and he won't cover his mouth. This is a really good reason to get a flu shot. So really understanding who they are real time to tie that in. Also highlighting the positive experiences. My own experience, I'll let them know I've gotten the flu shot every year since I was a college athlete. I stopped giving out the actual number of years that is these days because it's growing, but letting them know that I get the flu shot. And then also reminding them, look, I'm looking in our chart. We gave you the flu shot 2 years ago. You felt fine. So there's no reason why we should not do it again now, so that they can understand that and focus on the fact that you've done well with the flu shot. Because many people come in, like Dr. Quinn was saying, and say, oh no, I'm not getting that shot anymore. I got so sick the last time I had it and I will not do it. So sometimes we have to remind them of their successes to say, but not last year. Last year was not the year that you got sick. So I'm believing that last year will look like this year. Can we go ahead and give it to you? Also addressing their questions and concerns. I have learned that there is no question or theory or urban legend or myth out there that is not beneath my time to answer in the clinic. So sometimes that is answering the questions. Sometimes it is entertaining. Do you think they put something in there? Am I going to get nanoparticles in my vaccine? No, I don't think you can get nanoparticles. Well, I will pull out the box at times. I will show them the quadrivalent vaccine. We have even gone down to say, these are the 2 influenza A's in your flu shot. These are the 2 influenza B's in your flu shot. So really entertaining that, talking about what I expect for them to have in side effects, and even acknowledging that you're not the first person that's come in my office to say the flu shot made me sick. Because I think sometimes we're trying to skip over it because we don't understand why you should be ill. And I don't understand it. It's not an active virus. It's not live. So you should tolerate it very well. But I will acknowledge that somebody out there has been sick and maybe that person is you. However, I don't see anything that I've read or studied that makes me think that it is unsafe for you to get. And then also reminding people that, especially in Black communities, that you're not just protecting you. The COVID pandemic has been an economic downfall for many people. And what I've seen is that we are now, congregating in homes. Like people had to move out of their homes. They could not afford rent. Everybody's back home with grandma, grandpa, moms, dads, sisters, brothers. And so if we're all under the same roof, it now becomes even more important that we protect both ourselves and each other. And so community involvement and community awareness seems to be a big selling point for African-American families, because nobody is trying to kill their grandma. Not on my watch and not on your watch, right? Like, we don't want to hurt mom or dad. There's a baby in the house. Someone just had a brand new baby. And so when we start getting them to think about the whole family concept, that tends to be a selling point. And then the final one is explain the potential cost, which has gotten very easy. You can now go to the grocery store. I know here at Publix, you can get your flu shot and get a $10 gift card, which I would have done if my organization didn't say I had to get it at the job. So I tell them where all the free gift cards are. Some people can get it free at work. Also, we do not charge a copay to get it here. And you get asked twice in my office. So my MA is going to ask you, do you want the flu shot? And before you leave me, I am going to ask you. So if you thought that you were going to not have to say no twice before you really do not get vaccinated, you were mistaken, because we're going to ask early and often. And then also providing them an opportunity to have as least resistance as possible to get the flu vaccine. They can do them in nurse visits. Some people don't want to see me because Thanksgiving just ended and they know we've got diabetes to talk about. So they're trying to skip that appointment until they get it together. Fine, you can skip me. I'm still going to get you about your diabetes later. But how about you come in for a nurse visit and get a flu shot? And that seems to be a little bit easier when they're trying to avoid the things that come up in the holiday. That means they're not as optimized as they want to be before they see me back in the office. And so we are throwing everything at them to make sure that they understand what it is. They understand why they need it, and they know we will provide them every opportunity to be vaccinated with the flu. And that's really how I do it here in my clinic. So the wonderful thing about being a family medicine doctor is I see everyone, particularly in Columbia, South Carolina. I take care of complete families. So I know who got it. I know who didn't. And I also know that your wife sent you with a note reminding you that you were supposed to get your flu shot, because I saw her last week and she told me to let you know that you need to make sure you do that. So we use every opportunity to promote vaccinations in my clinic. And that's how I do it. Thank you for listening. Any questions?
Can I jump in here, Larly?
Yeah.
For a moment?
Absolutely. Let's open it up.
I just have to say, listening to both Dr. Kusher and to Dr. Jones, it's, they are doing the thing. They're taking things, from their own experience that we saw in research, and they're dealing with them and dealing with them very upfront. And I think, number one, I'm just blown away. But the other thing that I think is really important in what I heard, now I'm going to shift to COVID for a moment, is you both talked about the importance of family and community. And remember I said that, we saw that when people believed others that were close to them wanted them to get vaccinated, they were more likely to get vaccinated. And when they believed it was their moral norm to other people. And I think those kinds of messages along with, how do we stop this devastation that we're seeing? What are some of the ways we do that with COVID and stop the devastation from the pandemic? I think those are going to be critical ways of addressing this with patients and
I heard it kind of went quiet for me. How about you guys?
I still hear. It's a little.
And I hear you.
Okay.
So there is a question in the Q&A box. There's a couple. Great presentation. What potentially causes folks to get sick after they get the vaccine? And I mean, I heard the excuse a lot when I asked people about getting it. And I guess I will extend this question a little bit to both of you. From what I've been reading, the COVID-19 vaccine, at least in some folks, may pose some, more uncomfortable side effects. So what do y'all have to say about that? What causes the side effects? What do you think it's going to do with COVID-19 vaccine?
Well, I think Dr. Kusher is going to be better at that because he's well prepared for. I've read the articles that say that the COVID will have some significant symptoms, but as it relates to the flu vaccine, if I can remember right, we switched over from trivalent to quadrivalent around like 2016, 2017, where everybody was using it. And I felt like in the 2017, 2018 years, everyone was having side effects. So I don't know if it was because we went to a quadrivalent. I even had, doctors and attendees that were saying, I felt really bad after that vaccine. So I'm never really sure. I still stress the importance that the flu vaccine that most of us get is not a live virus, but maybe switching over to quadrivalent, had an increased immune response. So people were getting fevers and chills that were short-lived, but nonetheless. And so I try to acknowledge that. But over the years, I've heard less and less complaints of such a reaction, which makes me, a little concerned that maybe when we increase how much versions of the flu are in there, that they may have something to do with it. But that has decreased over the years. I get less complaints about fevers or chills after the flu vaccine.
Dr. Kusher, you have any thoughts?
I will tell you that I personally have had side effects after the flu vaccine before, and it's just a matter of the immune response. I think it's entirely reasonable to think that sometimes your body will have an immune response to the antigens that are being presented to it. And so I do acknowledge that also to my patients. And I say some people do feel flu-like symptoms when they take the flu vaccine, but that's okay. It's not the same as getting the actual flu where you could be hospitalized or die. So we just need to be clear about what that really means to people and say, yes, it is possible you can feel a little yucky for a couple of days, and that's okay. It's not as though you're really sick. Your body's just reacting and deciding that, okay, this is how we would fight it if the real thing came to us. Mm-hmm. In terms of the COVID vaccine, I have also read the reports that especially I think the Pfizer one, that's the Arctic cold one, there is going to be a lot of aches and pains for some people who get the vaccine. And we're also seeing that with even the shingles vaccine, the newest shingles vaccine. There is an extreme amount of side effects in terms of aches and pains that people are having and experiencing with that. But we just have to try to push the idea that it is worth it to push through those potential side effects because the benefits are so great, especially when we talk about COVID-19 and the level of death that people can have, and the fact we really don't know how the actual virus itself will affect any individual person. Yes, of course, people who are more vulnerable, older folks, people who have comorbid conditions, but that's not the only people who really suffer. That's not the only people who end up being long haulers. And I will tell you, that's the one thing that we don't talk enough about is the long haulers when it comes to COVID. We don't see that with flu, but we sure are seeing that with COVID. People who are continuing to be symptomatic for months upon months after their initial infection has gone away. Mm-hmm. And that is the thing. That is the next thing we really need to focus on, because that is going to be with us. There's not even an ICD-10 code to talk about the long haulers and the people who are continuing to be disabled by COVID-19. And the more we talk about that, the more likely it is that we're going to be able to convince people to take the vaccine, because not only could you feel feverish and feel really yucky because of the virus itself in those acute days, but then time period afterwards, you can continue to feel debilitated without any certain time frame with which you will feel better. So if we're able to talk about that, if we're able to push that message, we will be able to get more people to accept, especially in terms of the COVID vaccine.
Thank you. We have 3 more minutes. We do have a couple of questions for the group, for those who are attending the webinar, and then I'll try to get to the other questions that have been put forward. Let me just, as Keiko puts up the Q&A for the audience to answer, we will get you answers to your questions following this if we don't get to it. So here's a poll question. Please answer it. Keiko, I'm not sure if you'll be able to share the results with us or what time, how much time you're giving people. Very interesting. Do you have another question for us, Keiko? One interesting response I see in the chat box is people are saying that since they're social distancing and wearing masks, they don't need to get the flu shot this year. So let's see how vaccinated a group we are. Wow, almost 90%.
You know, if I may, you know,
Please.
address that, you know, we're social distancing, so I don't need to get the flu shot. We're actually not, is the reality. And the issue is that from a medical standpoint, right, from a clinician standpoint, what it means to be sterile, what it means to not contaminate your fields, what it means to, you know, be concerned about respiratory droplets and closed spaces and amount of time is so way more intense than what the layman is thinking about out there. So I have had to tell patients, you know, they come in and say, I can't believe this happened to me. Like, how did I get COVID or how did I get the flu? All I did was go to my cousin's house. I've been really distant, and I have having to point out the very points that, but that thing right there means that you're not distancing at all. Like when we said go home, we meant by yourself, like by yourself, and the only people that you were talking to in your house were the people who live there. And so it's been hard for people to transition being familiar with people, being common with people, to being distance. And so I do not think that even at our best effort that the average person is 100% safe. Now, it's hard to do. I'm a physician. I'm in the clinic every day. I got to go to the grocery store. I don't order it. I do my own grocery shopping. I'm running through the aisles like a mad woman, but I'm still in there. And so I think that the perception and reality is different. So I don't know that I believe that everyone is socially distancing. And so therefore you will not get the flu or COVID.
Thank you. That was great to hear that. We are at 1:01, which is past our hour. I want to thank everyone, especially our panelists, for such great information. We will share this recording, the chat notes, and try to get all the answers to you. I ask everybody who's still with us on this call, speak out next week in your community. Write to your local newspaper or community publication promoting flu vaccination and help protect your community even more. Thank you for all that you do, everyone. And Dr. Quinn, Dr. Jones, and Dr. Kusher, especially thank you. Stay well.